I'm Motohiko Kato from Keio University. I'm honored to be given an opportunity to have a lecture about the latest technology in therapeutic endoscopy. These are my COIs. First of all, bleeding is still a stressful event during the ESD. Even such developed a lot of endoscopic instruments. If we can manage and even avoid bleeding, we can improve the quality of the procedure and, of course, patients' outcomes as well. Recently, Olympus launched the latest endoscopy system, EBIS X1. EBIS X1 is capable to utilize 3 different image-enhanced endoscopes, RDI and TXI, in addition to NBI. In this lecture, I would like to focus on RDI. In RDI, 3 different wavelengths of light is used to form a contrast between deep and superficial blood vessels by utilizing the differences in absorption and reflection to hemoglobin. The 3 light used, red, amber, and green, have relatively long wavelengths, enabling it to penetrate deep tissue and have features absorbed hemoglobin to visualize vessels. RDI has 3 different modes for different purposes. Mode 1 is developed to facilitate identification of bleeding point, and Mode 2 is for visualized vessels. And Mode 3 makes a similar image to NBI, but it avoids pulled bar turns red. For example, cases with residual liquid in the colonoscopy, and then patient bile backflow into the stomach. First, I mentioned RDI mode 1. As mentioned before, it is developed to facilitate identification of the bleeding point. So it can be used for bleeding during the procedure and upper GI bleeding for hemostasis. This is an image bleeding during the ESD. In this image, a large part of the screen is bright red, and it is difficult to identify the bleeding point. So when switching to the RDI mode 1, pooled blood reduces, and identification of the bleeding point is much easier. You can see there is the less blood in the upper limb of the screen. And you can see the vessel branch and bleeding point easily. So this is bleeding during the duodenal ESD. I prefer to perform underwater condition, and in such case, it is very difficult to identify. But if you switch the RDI mode 2, we can easily identify the bleeding point, and then get hemostasis like this. Also, changing color has another effect. Red is a warning color, and turning yellow may reduce physician's psychological stress. Recently, a multi-center randomized control trial revealed the significant decrease of physician's stress. Though this study failed to show the shortening the procedural time. This was the primary endpoint of this study, but I think the get hemostasis has 2 steps. One is the recognition of the bleeding point, and the other is the treatment of the bleeding point. So maybe it is a reason for the negative result of this study. Of course, RDI is useful even for other bleeding. There are some reports on its usefulness of hemorrhagic gastric ulcer and biopsy hemorrhage under the cholangioscopy. You can see this is a hemorrhagic gastric ulcer, and turning to the RDI mode, then the blood reduced in the screen, and you can find out the bleeding point. And also, the cholangioscopy is done under water conditions, so it is very difficult to identify the bleeding point in such situation. This is a biopsy hemorrhage under the cholangioscopy, and you can find out the bleeding point by using the RDI mode. Next, I'll move on to the mode 2. Then it is developed to facilitate visibility of the vessels existing the deep mucosa or submucosal layer. This is a result of our pilot study. We conducted a pilot study for the potential usefulness of RDI. These are the subjective score of visibility of the vessel, and many endoscopists feels it improves visibility of vessels in particular in the esophagus. And then we also conducted the animal experience and found blood vessel with diameter of the about 800 to 2,000 micrometers at a depth of the 1 to 2,000 micrometer from the mucosal surface was well visualized by RDI. As you can see, the visibility of the vessel seems the best in the mode 2. So to confirm it objectively, we conducted the study. We used the recorded images and using the image analysis application, we compared the color difference between this kind of vessel part and the surrounding mucosa. As a result, there was a significant increase of color difference only between the mode 2 and the white light image. This reflects our subjective feeling is correct. So then the RDI mode 2 is most useful for the visualize the deep mucosal vessels. This is the case in which the color difference is the most. As you can see, vessel is although the vessels are faintly visible in the white light, they can be clearly seen in RDI mode 2, and the color difference is much more in RDI than white light imaging. So for what we can use the capability, our answer is for the injection of the esophageal EST. If we can be aware of the deep vessels, we can avoid unnecessary vessel injury caused by the puncture for the submucosal injection. And this is an example. So you can see the vessel. It is very difficult to recognize the vessel in the white light imaging. But if you change to the RDI mode 2, you can see the blood vessel here. So you can avoid injury to the injection. And if you inject a submucosal layer, and there is a lot of submucosal fluid, usually the vessels locating in the deep submucosal layer. So if you make a superficial incision just below the muscularis mucosa, you can preserve this kind of thick vessels. As a result, although this is a retrospective study, we compared the hematoma formation and the bleeding due to the puncture. We found RDI significantly reduced both hematoma formation and bleeding. So now we are conducting a randomized control trial to compare then white light imaging and RDI for esophageal ESD. And I show a case in which the RDI was quite useful. This case has an liver cirrhosis and underwent EVL. And this is an EVL scar, and you can see the superficial esophageal cancer is very adjacent to the EVL scar. So this patient has a high risk of the bleeding. So we use the RDI for the submucosal injection. We can use the RDI mode. It is very difficult to identify the vessel, but it quite improved the vessel like this. So we can avoid unnecessary injury to the vessel, barracks. Okay, so there is a vessel like this. So we can inject very carefully like this. In the esophagus, bleeding due to the submucosal injection is a quite a major issue. So we can avoid using this novel image-enhanced endoscopy. There's almost no bleeding due to the submucosal injection. And keep cutting, then not too deep, avoid the submucosal injuries, vessel injury. Okay. And once we go into the submucosal layer, we can directly observe the vessel. So the risk of the unnecessary bleeding is less. And this is a scar formation of the EVL scar, but I can successfully resect the lesion in a single piece like this. And patient discharged without any complications. Also, I use the, yes, you can see the beautiful specimen like this. And lesion was dissected successfully. So this is the summary. A novel IEE utilizing the 3 lights with the 520 to 640 nanometer wavelengths is RDI. This novel image-enhanced endoscope improves visibility of bleeding point or vessel existing deep mucosa by utilizing long wavelength length. Thank you for your kind attention.